Good morning, this is Rebecca. How can I help you?
This is just one of the dozens of calls Rebecca Laporte will take in a day.
I basically live on my phone. I probably take at least 3 dozen calls a day. Myself, the department as a whole, I think they keep a tally and it's pretty high. I think they receive hundreds of calls.
And how many people live in the home with you?
Laporte is a public health nurse for the Madison County Health Department. These days, her job is consumed with COVID-19 contact tracing.
That is our priority right now, is making sure that anybody who's positive or anybody who's exposed who's a Madison County resident gets notified so they're able to do what they need to do so we can stop the spread.
Rebecca tells me contact tracing is not new to public health, but because of COVID-19, the amount of contact tracing being done has increased exponentially. And what separates a COVID call from any other infection is the requirement to quarantine for 2 weeks.
Most people know, but there are, of course, some people who are surprised that they've been identified as a contact. One of the biggest questions we get is, how was I exposed? Who was I exposed to? And I think the hardest thing is telling people we're not allowed to tell you that information.
A person's privacy is important. They can only reveal when someone was exposed and when they will be released from quarantine. Regardless of where someone works or got tested, if they live in Madison County, they become Madison County's responsibility.
When we do our investigation for contact tracing, we determine who is a close contact. Close contacts are people who are within 6 feet of each other for 15 minutes or more, regardless of if they're wearing a mask or not. It also can be in enclosed spaces.
New CDC guidance suggests that short, repeated interactions that cumulatively equal 15 minutes or more can lead to COVID transmission. Madison County follows this new guidance. Once the county receives a positive COVID test from the lab, the contact tracing begins.
Okay. And are you currently having symptoms?
It starts with a phone call to the person who tested positive.
Was there anybody at work you'd consider to be a close contact?
A series of questions are asked to determine who that person had close contact with 2 days prior to their test or 2 days before they developed symptoms. A quarantine order is then given and they begin to reach out to each of the close contacts.
Just getting in contact with people is probably the hardest part, because when you leave a message and then they call back, you might be pulled to something else. So it's hard to get something done from start to finish sometimes.
If you are ordered to quarantine, you cannot test out of quarantine. Law requires you to stay isolated for the full 14 days after exposure. If the county can't reach you, they will text and call every day until the 2 weeks are up. As COVID-19 cases continue to rise, it's all hands on deck.
We have a lot of staff who are doing the contact tracing. There are nurses, there are retired nurses, there are other staff who have been pulled from their normal jobs to help us with the contact tracing. Everybody's lending a hand and it's really great.
In Madison County, I'm Olivia Dance reporting.
Okay, and when was your last day in the office?